Hi everyone. Oh, sorry, I think there was just a little bit of noise in the room. Thank you so much for joining us today. We really appreciate everyone coming and making their way out and making the long trek up to this room. It was a bit of a hike. With that, we're actually going to start today's presentation with a quick video, and we're going to get that started now.
I'm really excited about this three-site hospital model.
We're excited to see where Niagara Health can go.
It's truly amazing.
At Niagara Health, the key vision is by 2028, we will be a three-site hospital.
Our three-site system will include 3 cornerstone hospitals, Niagara Falls, St. Catharines, and Welland.
By the time we get to the three-site hospital system, patients and families will have access to the highest quality clinicians
For aging and wellness, stroke, cardiac, cancer, mental health, and women's and babies.
and they will be treated in a very modern healthcare system where we have state-of-the-art equipment, state-of-the-art buildings, which therefore will have best outcomes and best care. Services will be much more connected than they are now because we will have up-to-date infrastructure as well as information systems so that patients and their families' information travels with them.
Culturally, what Niagara Health is really made of. It's the opportunity for staff to engage with patients. It's the opportunity for them to engage with each other. Part of my job within our culture department is thinking about the wellness for our staff, the opportunities for them to feel like when they're coming into a building that they're taken care of and so that they can take care of others.
With focusing our resources at these 3 sites, we actually will enable better recruitment of staff, better retention of staff, and most importantly, best outcomes for patients.
I really wanted to become an ally on this project in order to help alleviate some of the fears in the community and start enhancing that conversation in different areas and ensuring that we are looking at the lens of not just process, not just policy, but the personal touch.
I'm glad that I became a patient partner. I'm glad that I was able to get behind the scenes and understand the decision making that Niagara Health makes. Decisions are made with a lot of thought, with a lot of engagement. As a patient partner, I was asked, I was listened to, and I was heard.
We want the region to feel and our staff to feel like we've considered how we can really support best patient care and also support staff to be able to do their best jobs every day.
Quality care is about people, not about a building. The future of healthcare requires access to family doctors and other community-based care providers. The Niagara Health System is working closely with the communities affected by this change to provide new ways to access healthcare.
We are blessed to be able to have these centers of excellence coming to Niagara and ensuring that Niagara is taken care of as a whole.
We don't want to leave our communities to go get care outside of Niagara region. We want that care right in our own community. So for us to transform the way we're doing right now, we'll take those services, especially services, and bring them close to home.
We're going to get the best care possible.
Hi everybody, I'm just going to do a sound check. Can the people at the back hear me okay? Yes, excellent. I was told I have to speak close to the mic, so if there's any point in time where people can't hear me, just give me a thumbs up to turn up the volume. So hello everyone, and thank you so much for joining us this evening to hear about and to talk to us about how we are transforming care in Niagara. My name is Lynn Guerrero. I'm the president and CEO of Niagara Health and a proud resident of Niagara. I have spent 36 years working in various parts of the healthcare system. I'd like to just take a moment to acknowledge the land on which we gather. Niagara Health remains committed to highlighting inclusion as a key driver for providing high quality care. We're committed to continue to listen and learn more about the history and current experiences of Indigenous peoples, and I acknowledge my own responsibility to take meaningful action towards reconciliation in the healthcare system. At Niagara Health, we like to say that actions rather than only words, and so we like to just comment on some personal reflections when we do a land acknowledgement. One way I've continued on my own journey of learning and reconciliation is to support the development of our first Indigenous Health and Reconciliation Strategic Plan. A plan that was created with input from many leaders from the Indigenous community across Niagara and was created by our own newly formed Indigenous Health and Reconciliation team. The plan will be launched publicly in April. My hope for this evening is that we have a really good dialogue, and we look forward to hearing your ideas and your concerns. Our plan to build a 3-site hospital model has been in place for many years. We were very lucky to maintain momentum throughout the pandemic, and we're happy to break ground on the South Niagara Hospital last summer. I'm joined on stage by my colleagues. First of all, Angela Zangari, Executive Vice President, Finance, Redevelopment and Facilities, and our Chief Financial Officer. Heather Patterson, Executive Vice President, Clinical Operations. And Dr. Satish Chawla, Interim Chief of Staff and Executive Vice President of Medical Affairs. The rest of my executive team are here tonight in the audience, and many of our board directors are here as well. I also want to thank our partners for being here today, including members of the Niagara Ontario Health team, some primary care providers from the community, Mayor Steele, who I haven't seen but I hope is here, and Mayor Grant. Oh, there's Mayor Steele, I see a hand, and hopefully Mayor Grant is here as well. So this is the second of many community engagement sessions that we'll be hosting as we continue for planning for the 3-site hospital system. We're very fortunate in Niagara to be in the process of building a brand new hospital in Niagara Falls, just 10 years after the opening of the new St. Catharines site. We're already also in discussions with the government to hopefully get a very significant redevelopment that will occur at the Welland site. And we have asked them for a planning grant so that we can move that project forward as quickly as possible. We're lucky in that, post-pandemic, other communities are just now starting their requests for capital projects. And we're very lucky that we were ahead of the game because we began this journey 10 years ago. And so we're well ahead of some of my colleagues who are also requiring capital projects. When we embark on these massive projects of change, it really forces us to think about how we're providing care across all of our sites and all of our communities, and also to plan well ahead. And that's why we're here tonight. While we're already 10 years into the planning, I want to remind everyone that we're still 5 years away from actually making the transition into the 3-site model. We've spent 5 years, we have 5 years, to figure out what this looks like and what happens with the site here in Port Colborne. I'm sure you'll have some questions on this, and which we'll answer during the question and answer session after the presentation, if we don't answer all of your questions during the presentation. We've really been working hard with the municipality, the provincial government, and healthcare partners to look at how we're going to provide high-quality hospital care to the residents of Port Colborne and across Niagara as we work to modernize our hospital system. My hope is that we can have a productive conversation today and hear your thoughts about the modernization. Before we jump into today's presentation, I just want to ask Carly Ellis to come back up, who is our moderator, just to provide a bit of an overview of what to expect at today's session.
Hi everyone, thanks again for being here today. My name is Carly Ellis, and as Lynn mentioned, I'm here to help moderate today's presentation as well as the question and answer period that we'll be getting to shortly. Today's session is going to conclude at 8 p.m. And here's the agenda for today. We're actually going to start with a presentation on our plans for a regional hospital system in Niagara, and then we'll proceed into that question and answer period. We are expecting we'll have about 45 minutes today for question and answer. We do ask that you save your questions for after the presentation, as many of you submitted questions in advance, and we did update our presentation in order to address some of those questions. When we do proceed into the question and answer period, we do ask that you only ask one question at a time. There's a pretty full room here this evening, and we want to hear from as many people as possible, so we will ask that you only ask one at a time. We are also distributing cue cards at the back, you may have noticed, so if we don't get to your question, we do encourage you to write down your question and leave it with us in the boxes. We are going to be completing a summary and some answers to some of those questions we don't get to, and we'll be posting that online. We are going to go over a couple rules of engagement for today's session. We are hoping to have a productive conversation, and so there's just a couple ground rules we'd like to go over. The first is we're going to ask folks to please maintain respect for this space and for others in the room. Please don't do anything that might prevent you or others from hearing whoever is speaking or cause any unnecessary distractions. We are going to ask that folks ask only one question at a time, as we mentioned, and we do ask that you raise your hand, and the facilitator on the floor will bring a microphone to you so everyone can hear your question. Before asking your question, please state your first and last name, as well as where you're from. We'd like to understand representation in the room. I will announce the last question when our time is up. That will be at about 7:50, so that we have some time for closing remarks before we conclude at 8 p.m. Again, a reminder that we do have an opportunity for you to leave some answers and some questions for us at the back of the room if we do not get to you. I also want to remind you that today's session is being live streamed, and so no necessity for you to film yourself. It's actually being live streamed so that those who weren't able to make it today have an opportunity to watch from home and also downstairs. I'm now going to pass things back to Lynn, and again, just remind you to please hold your questions till the end of the presentation. Thank you so much for being here.
Thanks, Carly. Okay, so just to start off the presentation, just want to acknowledge that we believe every person in our region deserves to live every day of their life in the best health possible. And that's sort of fundamental to our healthcare system. As a community hospital system, our focus on teaching, learning, research, innovation, and particularly our partnerships with others propels us to continually improve our care and the patient experience. In 2023, Niagara Health launched our new strategic plan, which we're very proud of. The root of this plan is people. So it's pretty fundamental. It's a fundamental plan in healthcare. The people meaning you, our patients and our communities, and also our teams who provide your care. Because without incredible teams to provide healthcare services, there is no quality healthcare to be delivered. But also central to this plan is designing a hospital system around the evolving needs of our patients, their families, and their loved ones. Our goal is to make it easier for you to access high-quality hospital services and have access to the best clinical experts and the best advanced technology. So talking a little bit about healthcare in Niagara, it's really essential that we recognize that hospitals are but one of a very, very complex healthcare system. And it's quite a puzzle to navigate through. Many of you have had to do that, I'm sure, in the past. And that's why we work with partners across the sector. So, for example, primary care. And when we say primary care, what we mean is family doctors and the teams that support them. Home care, long-term care, emergency medical services, so our EMS partners, public health, and community health centers. In order to deliver patient-centered high-quality care, all pieces need to function together and hopefully seamlessly. And high-quality healthcare is not based on any one thing, like a physical building. Now more than ever, quality healthcare relies on partnership. This is particularly important as we look at some of the external pressures our partners are facing as well. And we face these as well, which we'll talk about in a moment. This includes, for our partners, a shortage of family doctors. You've probably experienced that and heard about it. A shortage of long-term care beds across the province, and specifically here in Niagara. And similarly, just like the hospital, we have workforce pressures in home and community care as well. We wanted to talk a little bit about the types of care, just to make sure that people, when we throw out language in healthcare, sometimes people don't know what we mean. So we're going to just take the opportunity to talk a little bit about this, because it becomes important when we talk about having appropriate access to things like primary care and what we hope to happen with the site in Port Colborne once the hospital ceases to run the site. Access to family doctors and other primary care providers is essential to having a high-quality healthcare system. And the research on this is very clear. Access to comprehensive, team-based primary care, that means not just an individual family doctor working on their own, but comprehensive, team-based primary care, available to you when you're ill, is the foundation of high-performing healthcare systems around the world. We know this. And comprehensive team-based care is more than just seeing a doctor when you're sick. It's a team of professionals, including family doctors, as well as professionals such as nurses, nurse practitioners, dietitians, and mental health workers. And they assist you in staying well and help you to proactively manage things like long-term illnesses or chronic conditions that you may have. So primary care is there to keep you healthy, not just to treat you when you're sick. They do things like cancer screenings, manage your medications, conduct well baby checkups, the list goes on, it's quite extensive. And we believe strongly that that's what Ontarians deserve because it is the best care possible. And that is what we want to see in Port Colborne, and that's what we would love to see for the site here to be used for on a go-forward basis. We know that Niagara region is quite underserved in the area of primary care, and you've probably seen those numbers. We're working with our healthcare partners as well as the provincial government and the mayors to expand access to team-based primary care in our region. The conditions for which people seek care at our current urgent care centers are conditions that are most typically managed in a primary care setting. It's also important to note that the episodic care that you get at an urgent care center or a walk-in clinic is not the best care. It just isn't. Those teams don't know you, they don't know your families, they don't have your health record. You know, they might have your hospital visit, but not the actual comprehensive health record. So we will continue to work with the municipality and our primary care partners to increase these services, hopefully to be provided at our site here. That would be the perfect world, we think. And we recognize that you may have a lot of questions about this, and we look forward to discussing it with you during the question and answer period. So why are we evolving? I'm going to talk a little bit about that. So at Niagara Health, we essentially face about 5 major challenges that will require us to change the way we operate so that we can meet the future needs of our communities. First of all, our population is growing and becoming more complex in their needs as they age. So we have a growing population, but we also have an aging population. This is creating pressures on our hospital system, and as a result, we are one of the busiest emergency departments in our entire region of Hamilton, Niagara, Halton, and Brant. And we also perform the highest number of surgical procedures in the region. So the volume, whether it's in our ORs, whether it's in our EDs in Niagara, is increasing rapidly, and that is something that we need to make sure that we can respond to. The next would be team shortages, something else you've probably heard lots about. So like hospitals across the province and frankly across the country, we're facing shortages of healthcare workers across all of our teams and programs, but we really are feeling this the most in those who are trained to work in our emergency departments and in our operating rooms. We have over 400 staff vacancies right now, and we have particular challenges in recruiting nurses, personal support workers, and medical imaging technologists. These shortages reach across all areas of the hospital. And that number does not account for physician shortages. And the biggest impact on physician shortages that we feel are emergency medicine physicians, anesthesiologists, and general internal medicine physicians. And you can rest assured that we're doing everything we can to recruit new staff and physicians. And in fact, we filled over 2,500 positions, these are staff positions, between April and December of last year alone. And that's 2,500 positions filled in just an 8-month period. So we are recruiting as quickly as we can and as aggressively as we can, but it's an extremely competitive market out there in healthcare. Despite this effort, therefore, we know we're going to be dealing with health human resource challenges for years to come, unfortunately. So the third thing is disconnected care. We also need to evolve to create more connected care and better organize our services around the patient. Niagara Health is still using paper records, which is not a good thing, as you can imagine, and where we do have electronic systems, they're quite outdated. And this will be changed in September when we launch our new hospital information system. We also lack some specialty care at some of our sites, and often residents are confused about where to go for the health care that they require. And we want to take that confusion away. As well, our staff and physicians are also requesting a better connected system. It would allow them to work more efficiently and more safely for their patients. The health information system and the 3-site model will go a long way to creating a more connected team and more connected care for patients. The fourth thing is outdated infrastructure, and this won't surprise you for those of you who have been to our buildings. Our current sites in Port Colborne, Fort Erie, and Niagara Falls are quite old and beyond the point of renovation to meet the future needs of an evolving healthcare system. Our site in Welland, also quite old, requires major renovations and updates. We need to bring our facilities into the 21st century. It's what Niagarans deserve, and it's what we're going to deliver. And the new South Niagara Hospital will help greatly with this. And lastly, I just want to talk about limited physical capacity. Again, if you've visited an ED lately, you will notice how overcrowded they are. We're operating well beyond our current physical capacity, probably in every area. Our occupancy rate is typically about 115%. And you can imagine, therefore, it means that we have patients in beds where they're not actually in a typical patient space. A safe occupancy is somewhere between 80 and 90%. Our emergency departments are quite overcrowded, and recently in the last respiratory wave, we've had from day to day over 100 patients admitted, so requiring a bed, but staying in our emergency departments because they don't have a bed to go to. Capacity of 115% means nowhere to go if you need an admission. And that's why we have very long wait times in our EDs, mostly for patients who require an inpatient bed. So we need to evolve and build new spaces so that we can accommodate this growing and aging population. The time to change it is now, and we are lucky that we have a plan that's been more than a decade in the making that you're going to hear about now. And we'll start with Angela.
Thanks, Lynn, and welcome everyone. And as Lynn mentioned earlier, my name is Angela Zangari, and I'm the Executive Vice President for Finance, Redevelopment, and Facilities here at Niagara Health. I'm born and raised in Thorold, and I've been in Niagara Health for over 30 years right now. So we are well on our way to achieving our vision to replace the outdated and outgrown infrastructure with modern hospitals that will enable us to deliver truly connected care for all residents of Niagara, regardless of where you live. In order to provide the best quality care to our patients, we have to focus our limited resources and build seamless hospital care across Niagara with 3 cornerstone hospitals: the Murata Family Hospital in St. Catharines, the South Niagara Hospital, and the Welland Hospital. We anticipate that all services will transition to these 3 site models in 2028, so we still have some time to prepare. In addition, the system will provide access to specialized care in areas including mental health and addictions, cardiac, kidney care, cancer, stroke, complex care, wellness and aging, eye care, and maternity care. And while different sites will have their own areas of expertise, all 3 hospitals will work together as part of a seamless system of care. That means that as a patient, we'll be able to go to any Niagara Health site, even if the site doesn't offer the services that they need, they will be quickly transferred to the site that does. There will be no wrong door. The future must also include strong primary and community care led by the Ontario Health Team and community-based health partners. So what do these changes mean for our patients and families? Again, by building these modern and connected hospital systems, patients and their caregivers will be able to move seamlessly between services in our region. Patients will receive better access to hospital services and specialized care from the best clinical experts in state-of-the-art facilities with connected technology, private rooms, more beds, and services. A new and modern hospital system will also enable us to recruit and retain more expert doctors, nurses, and staff right here in Niagara. This means more staff providing care to our patients. And it will also help the region it's recruitment efforts to recruit community doctors as well, because everyone wants to work in those modern, state-of-the-art facilities. Everyone in Niagara knows the Walker Family Cancer Center, and that's the best place to get the cancer care in the region. Each of the 3 future sites will have similarly specialized programs that will offer the best of the best our local healthcare has to offer. Bringing together our teams creates a collaborative and supportive environment that we have already witnessed in the Murata Family Hospital, in our Women's and Babies unit, in Welland with our eye center, and in Niagara Falls with our stroke care. I really want to emphasize that quality healthcare is more than the physical building. It's about access to modern equipment and highly trained staff and physicians. So where are we in this process to build a seamless hospital system? We're about halfway there. So the St. Catherine's Hospital, the first of our cornerstone hospitals, was completed in 2013. We broke ground on our South Niagara Hospital last year in June. And we're, as Lynn mentioned earlier, we'll be redeveloping the Welland site pending confirmation of a capital planning grant from the province. So by the end of that process, we'll have 3 modern hospitals that will be Niagara Health. So the South Niagara Hospital. We're really proud of the South Niagara Hospital and the way that it will transform the way that we deliver hospital care. It will have 469 beds, increasing the regional capacity by 156 beds. It will offer a full scope of hospital services as well as centers of excellence in complex care, wellness and aging, and stroke. And if you've ever been to the St. Catherine's site, this site will be approximately 300,000 square feet larger than the St. Catherine's site, so quite significant. It will also provide 21,000 mental health and addiction day services, 74% more capacity for MRI tests, accommodate 7,400 more seniors wellness visits, and include 12 additional hemodialysis stations. So it's really exciting for me to imagine what the Welland Hospital could become in the future. We've, as Lynn mentioned, we've been working on that redevelopment plan as well and what it will look like into the future. But our transforming care plan for the Welland site includes 24/7 emergency services with 8 to 10 observation beds, complex care beds, a long list of outpatient services, clinics and medical and surgical services, mental health and addictions program, diagnostic imaging, kidney care, a center of excellence in eye care, and become the administrative hub for our team. As mentioned previously, we are currently planning for that redevelopment and will be submitting a proposal to the Ministry of Health for their approval. And pending that approval, we'll continue to have further staff and community engagement to determine what other services we can provide at the Welland site. So we're also very incredibly proud of our long-term care home in Welland. Currently, the long-term care home, much like the Welland Hospital, is outdated and requires redevelopment to meet the future care needs. In March 2021, the Ontario government announced that the 40 interim beds would become permanent, and they also approved an additional 13 beds, bringing the total to 128 long-term care beds. We are working very closely with the Ministry of Health and Long-Term Care to determine how best to rebuild the home and possibly add more much-needed long-term care beds to our region. Together, we can rebuild a campus that is more than a hospital. The hospital itself cannot provide everything. And with help from our partners, a redeveloped site could include preventative care by community health partners such as nutrition classes, art therapy, and exercise classes, a family health team, academic and teaching campuses for Niagara College, Brock University, McMaster University, and Trillium College. Unused land could be developed for senior supportive housing, an elevated transit hub, an indigenous and spiritual healing space, and even a community garden. So as you can see, the opportunities are endless as far as what that future can be. So we're really excited to create something truly special together. Thank you, and I'm going to turn it over to my colleague Heather.
Thank you, Angela. Hello, my name is Heather Patterson, and I'm the Executive Vice President of Clinical Operations at the Niagara Health. I'm born and raised in Niagara and started my career at Niagara Health as a candy striper a few years ago, and have worked at actually every site across the Niagara Health. I'm also a proud member of the nursing profession. To provide some context to the improvements in the future state that Angela was referencing with the regional hospital model, let me introduce you to Janet. She's an example of a potential patient. Janet is 58 years old, vet tech, who lives in Port Colborne. Janet is at work one day when she starts experiencing chest pain. She immediately stops what she's doing and calls 911. Niagara EMS arrives, assesses Janet, and it determines that she needs emergency services. She is transported to the Welland Hospital emergency. At the emergency, Janet is stabilized by a physician and staff and determined that she needs an elevated level of cardiac care. Janet is transferred to the Cardiac Care Center of Excellence at her St. Catharines site, now known as her Murata Family Hospital. In the new regional system, there would be absolutely no change in Janet's care if she experienced the same issues. EMS would still respond to Janet's 911 call and assess her and transport her to the emergency department in Welland, which in future state will be redeveloped and modern. Janet would be cared for by state-of-the-art equipment. If the team there determined she needed elevated care, she would still be transferred to the Cardiac Center of Excellence in St. Catharines to get the treatment that she needs. This is an example of how care for Port Colborne residents wouldn't necessarily change in this particular situation, but you would be treated in a redeveloped Welland site by the best clinical experts. Thank you, and I'll hand it back to Lynn.
Thanks, Heather. So a little bit about the road ahead. It's clear, and we're very much committed that the three-site model is very much committed to improving access to care. So following the opening of the new South Niagara Hospital, all hospital programs and services currently operated by Niagara Health will be transitioned from the Port Colborne site to the South Niagara site and the Welland site. And as mentioned, by bringing together our limited resources across the three hospitals, they'll be able to offer more specialized care to patients with the best clinical experts. As mentioned, our plan to redevelop the Welland Hospital on the same site is to redevelop the Welland Hospital on the same site. So the travel time from Port Colborne to the nearest emergency will remain the same. The new South Niagara Hospital is built about 10 minutes closer to people in Port Colborne than the current hospital in Niagara Falls, and will increase our emergency department capacity for the region substantially. By way of example, the new emergency department at the south site will triple the size of the current Niagara Falls site, and it will be able to accommodate approximately double the numbers of patients on a daily basis. Following the opening of the new south site in 2028, the municipalities will determine how to best use the Niagara Falls, the Port Colborne, and the Fort Erie sites for the benefit of those communities. Our vision, as I already mentioned, is with the municipalities to have community-run services such as primary care teams or perhaps diagnostic imaging at the Port Colborne and Fort Erie sites. And we are in active discussions with them on how to do this, as well as with Ontario Health and with the Government of Ontario when it comes to extension of primary care. But Niagara Health will no longer be operating those two sites after the transition. Okay, I'm going to have Carly start the question and answer, and as she mentioned, there will be mics circulating around. So, Carly.
Great, thanks so much. There are, just in case anybody is looking, there's about 3 or 4 seats up front here. If there's folks at the back that would prefer to sit. We are going to start with pre-submitted questions. We did receive quite a few questions from the community in advance of this evening's session, so I'm going to start with those, and then we'll turn it to the live QA as you mentioned. The first question, what are you doing to ensure Port Colborne residents continue to have access to urgent care and emergency care?
Can everyone?
Yep.
Making me really nervous, sorry about that. So we know that the residents of Port Colborne and Fort Erie are extremely concerned about their access to healthcare services. And we hear you and we understand that. And I want to assure you that we are committed to providing high quality care for everybody in Port Colborne. Our plan to redevelop the Welland Hospital includes a commitment to 24/7 emergency services. We're also building a brand new hospital in Niagara Falls, as I just mentioned, which triples the capacity of that emergency department, so much sort of less crowded, better care in that ED with a highly specialized team surrounding the patient. As I said, that location, although the Welland location will be the same, the new south site will be about 10 minutes closer to Port Colborne than the existing Niagara Falls site. We've already mentioned that in a modern hospital system, centralizing teams around larger cohorts of patients or around larger volumes of patients is best for quality care. So we really believe that centralizing the services will really increase the quality of the care in our emergency departments. And then, as mentioned, for conditions that are currently seen at the urgent care center, we're working with our local healthcare partners and the municipality as well as the provincial government to expand comprehensive team-based primary care. And we're really fortunate that we have recently seen an announcement from the Ministry of Health starting that process. So they did expand some primary care teams. Port Colborne was announced as one of the areas to receive that money. And we've been working actually really closely with Mayor Steele on what that might look like. And we're very interested in having that team exist within the Port Colborne site. So that's our hope for the future. And that would be comprehensive care to, as I mentioned, not just treat you when you're ill, but actually try to keep you healthy.
The next question that we had from the pre-submitted questions. Will you reopen the emergency department in Port Colborne? And will you make the UCC 24/7 again?
So back in 2009, Niagara Health and the provincial government made the decision to close the emergency department in Port Colborne and consolidate the acute care services from the Port Colborne site into the Niagara Falls site. And so the Port Colborne site has not been a hospital with an emergency department for about 15 years now, so that's not changing. In terms of the urgent care center, we did have to make the very difficult decision to reduce the hours, but I can't remember, maybe about a year ago now. And that was a really tough decision. We knew it would have raised concerns and have an impact to the communities. At the time, and we still do have pressures in our emerges, we started to have such a shortage of emergency medicine physicians that we were at the point where we were going to have to not only close the urgent care centers for certain shifts, but we were also going to have to close our emergency department for certain shifts. And that would have reduced life-saving emergency care at our emergency departments. And that is something that we absolutely could not let happen. So we had to make the difficult decision to reduce the hours of the urgent care centers, those hours being overnight, so that we could consolidate our teams and hopefully not have to close any hours of our EDs. So far that's been successful. Many EDs did have to close some services across Ontario. We've been fortunate that we haven't had to. And we don't think that that's going to end anytime soon. As I've said, we know that it's a very highly competitive market for emergency trained physicians. So although we're constantly recruiting, it's not something that's going to be solved in the next couple of years, I would suggest.
Excellent. There's quite a few questions that came in regards to the new Welland Hospital and what might happen at the Welland site. I think this question is probably best suited for Angela, since it's about the redevelopment there. Will there be inpatient beds and an intensive care unit at the Welland Hospital when redevelopment is completed?
Thank you, Carly, and thanks for the question. So just to reiterate, the Welland site remains one of our key cornerstone hospitals of Niagara Health. We'll continue to have complex care beds at the Welland Hospital site, but due to our limited resources and planning that's already completed for the St. Catharines site and for the new South Niagara Hospital, there are no plans to have medical, surgical, or critical care ICU beds at the Welland Hospital. What we will have, and pending again that approval from the Ministry of Health, is that we'll have a wide range of services, including that 24/7 emergency services, and including 8 to 10 observation beds. It'll also feature a center of excellence in eye care, so for cataract surgeries, you continue to go to the Welland Hospital site, and a wide range of outpatient programs, including dialysis, diagnostics, and mental health and addiction services. So when I say diagnostics, I mean your x-rays, your lab, your CAT scans. You'll continue to go to the Welland Hospital for those types of services. And our plan for the Welland site is not fully finalized. So when I'm saying outpatient clinics, from a medical and surgical perspective, we haven't decided and defined what type of clinics those are. So we're hoping that once we do our outreach with our community and our staff, that's when we'll get more refined as far as what does the community need to be offered at that site, so that you're traveling the same as you would be to there. So I'm really excited again about the work that's coming for the Welland site as well.
Fantastic. Thanks so much, Angela. So that concludes the presentation portion of our evening. We're now going to move